Joining me in the studio this morning is Dr. Julio Santiago with Solvera Health. Good morning, Dr. Santiago.
Good morning, Vanessa. It's great to be here today with you again.
Good to see you. It was really nice having you last month at the Health Forum. Appreciated that.
It was really great. I really liked participating in that.
Good. Well, we're glad to see you here today. We're going to talk about some of the things that are happening, what people are being treated for, the time of year, is allergy season, all that good stuff. But first, remind us about Solvera Health and tell us a little bit about you.
All right. Solvera Health or Solvera Health Care, I think there's really two words I think you should keep in mind. One is hospitality and the other is a solution. So hospitality, when I talk about that, that really means that's sort of sacred duty to welcome strangers and friends alike into our communal spaces, clinics, where we can offer comprehensive care. And solution, which is part of the word Solvera, where it sort of originated from, allows us to become part of the solution, to deliver health care, to open up access to care, to primary care as well as specialists.
Well, healthcare certainly has changed a lot, especially during COVID and post-COVID. Describe some of the changes that have been happening in healthcare.
Well, that's a good question. And some of the changes that I've seen through the pandemic, we had really closed down. We had to isolate a lot. And that has changed since the pandemic has dissipated to a large extent. So we're now trying to improve on the accessibility to primary care, as well as trying to increase the manpower to take care of all these people in the community.
We talked a lot about manpower at the Health Forum. It does seem like that is one of our biggest challenges, is being able to get the next appointment, having to wait in between appointments during your care routine, if you will, or care package.
Right.
Describe that, how we're working on the manpower.
Well, we're trying to recruit more people into helping take care of those preventative services, so that will allow access to care and improve on screening for primary care, those things like mammograms, colonoscopies, and such.
Okay, tell us about you. You're no stranger to our audience.
Yeah, I've been around the area for about 20 years. Originally from Chicago, and went to school in Bloomington, Normal area, then to Iowa, and was with the United States Navy, bounced around the world, and came back to Bloomington, where my family's from, and gradually moved up to this area and been here for the last 20 years.
Okay, fantastic. You're seeing that change of seasons. What are people coming into Solvera Health needing treatment?
Yes, that's change of season. Fall's fast approaching. And as we see the goldenrod along the road, as well as ragweed, as well, and the other grasses that are pollinating still, we've had high pollen counts in the past month due to those weather changes. And so we're seeing that, as well as kids returning back to school. So they're going to need their physical examinations updated, as well as their vaccinations. We're also seeing the cold and flu season coming along. So we're going to have to really work on getting those preventive measures in place. And when I say that, I really mean the influenza vaccine as well as the COVID booster, because our first step in prevention is the vaccination.
Are you seeing COVID right now?
Yes, we're seeing a little uptick as we're anecdotally, and so that seems to be spreading fast. And you'll probably be hearing about high school kids returning home because they're sick, and spreading pretty fast in the school systems.
Have we been? Are we able to keep the hospitalizations though down and the severity of the symptoms down?
Yes, with the current strain of virus that's out there for COVID as well as influenza, we're still seeing the symptoms not as intense as they were as the pandemic began. So we're going to see a lot of people being sick with cold symptoms. So they'll probably return home and just take care of themselves without having to spread the virus to people who have immune compromised systems.
Sure. And remind us, how do we know if we have the flu? Do we have allergies? Do we have COVID? What's been really awkward about the three that I just mentioned is they come and go. That's
That
what's
is,
been unique since the post-pandemic. Normally, you
yeah,
got sick, you were
yeah,
sick for a
that's,
few days, you stayed home, you got better. But sometimes it
yeah.
seems like it drags on.
That is so true. And with the allergies, you're going to see primarily itchy eyes, itchy nose, itchy ears, uh, postnasal drip. Now, with the viral illnesses, you'll see some of that, but you may also have a sore throat, achiness, fever. Usually around 102 is going to be your fever for any of the viruses, and primarily influenza. But those things in conjunction with fatigue that seems to just say, hey, you need to lay down and rest. So that's going to probably be the differentiation between allergies and virus.
Okay.
Yeah.
All right. You also manage chronic conditions such as diabetes, hypertension, COPDs. How is that
Yes.
going? What's the management style that you have, Dr. Santiago?
So yes, I do see a lot of the chronic conditions like hypertension, diabetes, COPD. So we're trying to offer comprehensive management of those particular conditions, and we'll include specialists if we need to, but primarily addressing those with medication, laboratory evaluation, and routine follow-up.
Okay. Now, interestingly enough, we fall in a demographic where it's so specialized when companies advertise now. You know, they've got their algorithms for the demos. And so on your
That's so
phone
true.
or even streaming on your tablet or watching a game, I watch a lot of Razorback games on my tablet because I
Yeah.
don't get them here. But it seems like there's pill commercials over and over and over again.
Yeah, what's up with that?
Yeah, what's up
What
with
are
that?
I know I was watching TV last night. It was like every other commercial was some new medication, some type of biologic, and for either psoriasis or some type of eczema or asthma that's related to increase in eosinophils. So, but you have a lot of the companies have algorithms, and also a lot of the specialist organizations develop algorithms or guidelines to treat those chronic conditions, and we try to follow them as closely as possible. There is a sort of a spectrum we can move within to change the medication or try something different. So, but that's what you're going to see, a lot of different medications that are out there, a lot of pills that will keep you away from injectable therapy as long as possible.
Okay. And talk about some of those pills being used to treat diabetes. The one of the side effects is the weight loss, which may help with A1C numbers, which can help with diabetes, insulin resistance. Talk a little bit about those.
That is so true, and that's a great point or observation that we see a lot of the medications that are used for control of diabetes also have injectable forms, which as a side effect reduce your weight to a certain extent, and that has allowed for certain medications to be offered for primarily weight reduction.
And you're finding that to have some success?
Oh, significant success I've observed with these particular injectable medications in regards to control of diabetes and weight reduction. Usually, I've been seeing about a quarter of the body weight being reduced. So,
And you said injectable. So there's one in particular that's, and there's probably more, that's injectable. What's the difference? Obviously, not having a healthcare background, you've got the capsule, you've got tablet, you've got there's different forms of a pill. There's
right.
different and how that works. And I heard
Right.
that from our director at the Strom Center, helping people with their medications as they file for Medicare Part D. And that makes a difference on the release in the body. Is that accurate?
That is so accurate that there are pills that they'll use for control of diabetes, for example, that will allow you to lose a certain type of or a certain amount of weight, but if you do progress or your diabetes condition worsens, there are also injectable medications that can be used to improve the control of diabetes by, one, making you feel like I don't need to eat, and secondly, telling your mind, saying, no, you don't have to have an extra helping. So that's where the sort of portion control starts to come into play, because you're not eating as much, and you're probably thinking, well, I got to eat smarter. I got to decrease my carbohydrates. I got to start doing some routine exercise. It doesn't have to. You don't have to be a marathoner, but you have to get out there and do some type of activity to help your metabolism utilize those carbohydrates, that energy you're putting into your body.
Yes, you're right. And I'm sure you talk to a lot of patients, and one of the struggles is age, because you're fighting that age where, it starts happening, but also the injuries that can happen as you get older. You may hurt an ankle or a reoccurring knee, or you name it, and it makes it tougher to exercise routinely. Or that could be an excuse, Dr. Santiago.
But that's so true, because with inactivity, you sort of lose that sort of flexibility. And what I do with most of my patients, I'll counsel them on daily flexibility exercises, which will improve their mobility, which will in turn and ultimately keep them independent. So if I can reduce your weight when you're younger, I can hopefully slow down the process or prevent significant osteoarthritis from developing in your knees, your back, which will in turn decrease your mobility as a result of decreased flexibility. So we want to maintain your quality of life as long as possible, that you've come to know and love. So.
Okay. And last time we talked, it was back in February during Heart Health Month. And you had some really good advice for people that you shared with us about, the 5-day mentality, if you will. So tell us about that.
Yeah, back on Valentine's Day, I was here and we talked about what I call the focus strategy to improve your health, both physically and mentally. And the F stood for find 5 days where you are eating right, feeding your body good food, and feeding your mind good thoughts, because both affect each other. So if the body's not feeling well, it will affect the mind. If the mind's not feeling well, it will affect the body. And the second was to increase. This was on Valentine's Day, so I talked a lot about oxytocin and trying to increase those oxytocin levels in your mind to improve control of your anxiety as well as your depression. And that entailed singing, dancing, looking at beautiful art, interacting with people that you enjoy interacting with. So those things. It's called the cuddle hormone.
Of course.
That was also on Valentine's Day. That was more appropriate.
That's also what puppy dogs are for.
Yeah, that's right. Yeah, that's
or kitty cats.
Yeah, pet therapy. And then for C, it was core, looking at core meaning heart, and that there are 2 hearts, 1 heart in your mind and 1 heart, physical heart in your body, and to work on those 2 to find that certain balance to keep your heart health as well as your mind health strong. And part of that focus acronym was to find positive things in your life to uplift yourself. So you're looking for positive thoughts, positive interaction, those things. And then S was to look for strategies to achieve those goals that you've set for yourself. And I was trying to get you to engage you to say, hey, come on over to Solvera so we can help you find those strategies to improve your health overall.
Oh, good. So you do that.
Yes.
Okay.
Yeah.
So folks can make an appointment with you and you can help them achieve those goals. Because sometimes it seems overwhelming when you have multiple areas of focus you need to be thinking about.
Right. You need to simplify and strategize what I can do or you can do to improve your overall health.
Okay. What's your phone number? How do people make an appointment? And I do believe you're taking new patients now.
Yeah, so... yeah,
or go to solverahealth.com as well.
Yeah, that would be the best way to do it.
Okay. Yeah, because there are multiple phone numbers for the Galesburg location, which is over on Swangataha Road. So easy to find.
Yep.
And you're right there in that building. So solverahealth.com. Dr. Santiago, anything else you want people to know?
No, just try to remember those 2 words of hospitality and Solvera, and we're part of the... sort of the solution to engage you and to welcome you to Solvera.
Okay. Thanks for coming in today.
Thank you, Vanessa.